Chronic telogen effluvium, CTE, your complete guide to hair loss for all genders. Hair loss is a common concern, impacting people of all genders. Among the various causes, chronic telogen effluvium, CTE, stands out as a condition that can be distressing. Unlike androgenetic alopecia, AGA, which is the most typical cause of hair loss, chronic telogen effluvium leads to diffuse hair shedding throughout the scalp without specific signs of balding. In this guide, we'll explore CTEs, chronic telogen effluvium, causes, symptoms, diagnosis, and treatment options for both men and women. Understanding chronic telogen effluvium. What is chronic telogen effluvium? Chronic telogen effluvium, or persistent telogen effluvium, affects individuals of all genders. It involves excessive shedding of hair in the telogen phase, a resting period in the hair growth cycle. Unlike androgenetic alopecia, chronic telogen effluvium doesn't result in distinctive patterns of hair loss like receding hairlines or thinning crowns. Instead, it leads to overall hair thinning and increased hair shedding. Chronic telogen effluvium causes. While the exact causes of chronic telogen effluvium remain unclear, several factors may contribute, including hormonal imbalances. Fluctuations in androgen levels and other hormonal changes can disrupt the hair growth cycle, triggering chronic telogen effluvium. Stress and emotional factors. Psychological stress, trauma, and emotional disturbances can affect hair follicles, causing excessive shedding. Nutritional deficiencies. Inadequate intake of essential nutrients like vitamins and minerals can compromise hair health, potentially leading to chronic telogen effluvium. Medical conditions. Some conditions, such as thyroid disorders and autoimmune diseases, may be linked to chronic telogen effluvium. Medications and treatments. Certain medications, like those used in chemotherapy and radiation therapy, can cause temporary hair loss known as drug-induced telogen effluvium. Chronic telogen effluvium symptoms. Both men and women with chronic telogen effluvium may experience increased hair shedding. Individuals notice excessive hair loss throughout the day, leading to more hair strands on pillows, shower drains, and combs. Thinning hair. Chronic telogen effluvium results in overall hair thinning, reducing scalp density. No specific pattern. Unlike androgenetic alopecia, chronic telogen effluvium doesn't follow a distinct pattern of hair loss. The shedding is diffuse and affects the entire scalp. Chronic telogen effluvium diagnosis. To diagnose chronic telogen effluvium, a dermatologist or hair specialist conducts a comprehensive evaluation, which typically includes medical history, inquiring about underlying health conditions, medications, and recent life events. Physical examination. Close examination of the scalp and hair follicles to assess shedding and signs of inflammation. Hair pull test. Gently pulling hair to count shedding hairs. Chronic telogen effluvium typically shows an increased number of telogen hairs. Blood tests. Ordering blood tests to check for hormonal imbalances, nutritional deficiencies, or other medical conditions contributing to chronic telogen effluvium. Chronic telogen effluvium treatment options. Several treatment options can manage the condition and promote hair regrowth for both men and women. Treatment varies based on underlying causes and severity, including addressing underlying health conditions. Treating medical conditions like thyroid disorders can alleviate chronic telogen effluvium symptoms. Stress management. Adopting stress reduction techniques can minimize stress's impact on hair health. Nutritional supplements. Some individuals may benefit from dietary supplements containing hair-nourishing vitamins and minerals. Topical treatments. Prescription topical treatments with minoxidil, an FDA-approved hair growth agent, may stimulate hair regrowth. Platelet-rich plasma (PRP) therapy. Injecting platelet-rich plasma into the scalp can promote hair regrowth. Lifestyle modifications. Making healthy lifestyle choices can support overall hair health. Hair care practices. Gentle hair care practices can prevent further damage and breakage. Chronic telogen effluvium and hair thinning. Unlike androgenetic alopecia, which leads to specific patterns of hair loss, chronic telogen effluvium causes overall hair thinning without distinct bald spots or receding hairlines. This diffuse shedding can make hair appear less dense and voluminous. However, with proper management and treatment, hair regrowth is possible. Coping with chronic telogen effluvium. Dealing with chronic telogen effluvium can be emotionally challenging, impacting self-esteem and causing fear of hair loss. Strategies for coping include seeking support, educating oneself about chronic telogen effluvium, prioritizing self-care, experimenting with hairstyles and products, and considering professional counseling. Ensure you adhere to the expert advice from Hair SN Care's professionals to achieve optimal results.